a urinary tract infection (UTI) in any part of your urinary system. The urinary system organ includes kidneys, renal pelvis, ureters, bladder, and urethra. Most infections of the urinary tract occur in the bladder and urethra. Urine is a byproduct of our filtration system and typically does not contain bacteria. Urine is created when waste products and excess water are removed from the kidney's blood. Sometimes, bacteria can enter from outside the body into the urinary system and cause problems like infection and inflammation. This is called urinary tract infection. UTIs are very common. Around 1 in every 5 women face UTI problems in their lifetime. UTIs are more common in females because a woman's urethra is shorter than a man's, making it easier for the bacteria to get into the bladder. UTIs can also happen in men, older adults, and children. It is estimated that every year around 8 to 10 million doctor visits are only due to UTIs. So viewers, it is very important to understand the signs and symptoms of UTIs because if an infection begins in your bladder or urethra and is left untreated, it can infect your kidneys, and this condition is called pyelonephritis. Today's video will discuss 8 early signs of UTIs. We will also discuss the risk factors of UTIs, which will help you to understand how you can avoid UTIs infection. Common signs and symptoms of UTIs. The urine of most healthy and adequately hydrated people is nearly free of odor and light yellow or clear in color. The person also feels zero pain or discomfort during urination, but the majority of the people experiencing UTIs are likely to encounter one of the following symptoms: burning or pain while urinating. Bacterial infection irritates the urinary tract lining and spurs inflammation that can cause unpleasant sensations. Cloudy urine. When the body fights against the bacteria in your urinary system, white cells accumulate the infection site, which causes the cloudiness of your urine. A consistent and strong urge to urinate. When your urethra and bladder are inflamed due to infection, this can mess up with receptors that signal when you need to pee, and you can feel a strong, constant urge to urinate at all times. Passing only small amounts of urine at a time. Due to swelling of the urethra, small amounts of urine pass through it and give the feeling of bladder fullness. Blood in the urine. If the urine color appears red, pink, or cola, this indicates blood in urine due to UTI infection. Strong smelling urine. Bacteria can cause a fishy odor, mucus, or pus-like urethral discharge. Your bladder and urethra natural mucus are attempting to clear the body of germs. This UTI symptom is more common in men than women. Lack of bladder control. Inconsistent urine or lack of bladder control is particularly common in older adults. If you are experiencing one of these symptoms, then consult your doctor as soon as possible. And it is also important to understand the risk factors of UTIs. Female anatomy. As we mentioned earlier in this video, a woman has a shorter urethra than a man, which shortens the distance that bacteria must travel to reach the bladder. Certain types of birth control. Women who use diaphragms of birth control may be at a higher risk of UTIs. Menopause. After menopause, a decline in the circulating estrogen causes changes in the urinary tract that make you more vulnerable to infection. Want to know more about early signs of ovarian cancer? Check out our video on the 7 early signs of ovarian cancer that every woman should know. Other risk factors of UTIs include catheter use. People who can't urinate independently use a tube called catheter to drain urine from the bladder through the urethra. There are chances that the bacteria is passed through the catheter tube into the bladder and cause infection. It is estimated that around 75% of patients in hospitals who develop UTIs are due to catheter, also called catheter-associated urinary tract infections. Blockage in the urinary tract. Kidney stones or an enlarged prostate can trap urine in the bladder and increase the risk of UTIs. Remember, this video is for educational purpose only. We are not giving you medical advice. And so you should always consult your doctor if you need any professional opinion. Did you find this video helpful? If yes, then like this video, subscribe to our channel and hit the bell notification button to view more upcoming Create Cure content like this.